What's the difference between a heart attack and cardiac arrest? We're going to talk about that today. I'm a board-certified diagnostic and interventional cardiologist, and if you like what you see, make sure you subscribe so you can see new videos each and every week. So let's get right into it. What is the difference between a heart attack and cardiac arrest? Well, most people don't really know the difference, and in fact, when they use these terms interchangeably, they're actually talking about one specific thing, which is a myocardial infarction. But there are different types of myocardial infarction, and we want to break it down into two categories. So when you think of a heart attack, you may think of somebody clutching their chest and collapsing to the ground. That's actually a cardiac arrest. That's one type of myocardial infarction. When we say we had a heart attack, we're actually talking about a blockage of blood flow to the heart muscle, the coronary artery supplying blood flow to the heart muscle. When that blood flow is blocked, it can cause a portion of the heart muscle to die. That is called an acute myocardial infarction, or a heart attack. The other type of heart attack is called a silent heart attack. This is where a person doesn't have any symptoms at all, but there is damage to the heart muscle due to a lack of blood flow. How does this happen? Well, when that blood flow is stopped, the heart muscle can't get oxygen. If it doesn't get oxygen, it can't contract and pump. And if it can't contract and pump, then you get a buildup of fluid in the lungs. That can cause shortness of breath. If it's a complete blockage, the person will quickly become unconscious because the heart is not pumping blood to the brain. Now, in a silent heart attack, the person doesn't have any symptoms, but we see the signs on the EKG, and we see an elevation in certain cardiac markers, which means there's been damage to the heart muscle. So we know for a fact that there's been a heart attack, even though the person doesn't feel anything. In a cardiac arrest, the person is conscious at first, but then they become unconscious because the heart stops pumping effectively. So in both cases, there is damage to the heart muscle. We just don't see symptoms in both cases. Well, thank you so much for watching today's video. Again, if you liked what you saw, please make sure you subscribe and share this video with your friends. Until next time, take care.